Well, friends, welcome to today's webinar. And today, Dr. Barna Ganguly will be taking the third part of the competency-based assessment lectures. Over to you, ma'am.
Thank you. Thank you so much. Hello, good evening, everybody. Those who are attending, today we are here. This is the third and the last part of discussion on competency-based assessment. So since last two sessions, we started with assessment, which is related to competency-based assessment. And today we are taking up certain other issues related to competency-based assessment. So today we will be winding up this the session of assessment, and we will be discussing certain issues and challenges related to competency-based assessment, and if there is any suggestion on this newer approach. So far, what we have understood on competency-based assessment. Because we are taking up competency-based medical education, so the assessment also should align with that. That means the assessment should align with competencies, domain level, and SLOs. Thus, we have two types of assessment in front of us in order to start competency-based assessment: formative and summative. Summative is the final exam at the end of 1 year, that is the university examination. But formative assessment is a continuous process which is to be reflected finally in the internal assessment, and whatever we are assessing throughout the year, we may assess many things, but certain things we have to structure, which is the collection of those will reflect to the internal assessment. Formative assessment should be a regular one, periodic examination, and it should be multiple, means there should be multiple assessments based on expected competencies. We can take it in the form, in theory, in the form of MCQ tests. Even in the lecture class, we can take in quiz, theory tests, then term end exam, or which also known as internal exam, and in practicals also in various ways. We have to continuously, this is the key word for formative assessment, that is continuous assessment. So theoretically, in various literatures, in various countries, people are doing many things. But let us focus in our Indian context. What we can do in our scenario according to feasibility, according to what is provided resources. Theoretically, many things can be done, but we have to think, can we incorporate all the things in our setup? Are we ready for that? So I thought whatever is feasible for us, let us enlist those things first. In written, multiple MCQ tests are feasible. Periodic written examinations in the name of term end or first internal test or internal tests, in that way it is feasible, as well as during lecture classes, which doesn't require any other special time, or maybe we can arrange that also from the, for testing the knowledge or progress in the on theory, we can arrange for quiz. In practicals, whatever is feasible in our setup are, we can give assignments to all the students which will be assessed, where the marks can be given, and we can document that. In practical, we can go for OSPI, and other types of examinations, other types of tests in periodic practical examinations like prescription writing, then other things, prescription audit, problem solving exercise, etc. And other things which we can also do in practical are, if some students are interested in projects, individually, collectively, in groups, we can do that, but provided we should structure them in such a way that some credit has to be given against those projects. So I found these are the areas which we can take up for continuous assessment in the formative assessment, and some of them can be kept in the summative assessment as well. So whatever assessments done throughout the year has to be structured, has to be documented. We have to structure the weightage of each examination, finally boils down to internal assessment. And this is the visa for appearing to the final examination. There will be separate session on internal assessment, so I am not going in details of internal assessment again. It is just a recapitulation of previous session. So the internal assessment, it will contain the marks of all the written test. Whatever we can do in our setup, we can organize MCQ tests, periodic test, term and prelim examination. In practicals, whatever we will be doing and giving the marks, so also in viva, all has to be added and will be shown as internal assessment mark, which will not be added in the final examination, but 50% of it is the criteria for sitting into the university examination. In last session, I have discussed on to prepare some sort of calendar or how many exams we can take in our setup. I just showed some examples and all, and I asked the participants to prepare some proposed schedule or calendar for coming year, second MBBS, who will be joining us perhaps in October. In September, they will be, October, they will be joining us. So let us prepare one schedule or plan. So Dr. Sunita Chaya and Dr. Dimple Mapara has sent their schedule, some proposed 1-year schedule on assessment, if not on assessment teaching learning. It is the schedule of assessment which I showed, and they have shared there. So they are suggesting, like in November they can take, October once they join, in November they will be taking MCQs. In January, first internal examination, in April, second internal examination, and in June, one quiz, and in August, prelim examination, because in September, they will be having the university examination. I have got some reservation here in theory MCQs. Can we have enough
Dr. Barna is offline. I'm just connecting her. Okay. Okay. Hello? Hello?
Am I audible now?
Yes, you are audible now.
Am I audible now?
Yes, you are audible.
Okay. My screen is visible?
It was visible now.
Hello?
Yeah. Now it's a black screen. Uh,
Just a minute. I'm trying.
I'm making you the presenter again.
Okay.
Yes. Now it is visible.
But where
You have to start your
is it?
PowerPoint again.
Yes.
Yes.
It has gone somewhere. Excuse me for the break. Let me open it again.
Yes, ma'am.
I'm sorry, something happened here. Hello?
Yes, ma'am. Please continue.
My laptop has got hanged. Can you just give me 2 minutes time?
Yes. It's opening. It's opening. Yes.
I'm really sorry for the disruption here. So what I was mentioning that I have a reservation in conducting MCQs in November because of the less content. Otherwise, if that be so, we can keep more frequent because we can only assess the general pharmacology portion here. And then in January, first internal, April, second internal, and in June quiz. Quiz can be kept anytime because quiz, we cannot individually mark the students for our internal assessment. So quiz can be kept at any moment of time, soon after each system, half an hour class for in the next class as quiz. So should we keep quiz formally or structure quiz for any specific month? That is my question. Similarly, in practical, it is fine. And as per MCI document, GMER, we need to have minimum 3 examinations to cover up internal assessment. So in that way, you are having 3. In fact, in practical, you are having 4. So it is good enough. But placing of MCQ according to month is a question for me. What we have planned in our institution is this one, that October 1st MCQ can be kept in December. Usually we keep it in January, first MCQ. And then terminal exam or first internal exam in April. After that, the students go for summer vacation. July, again, the second MCQ. And in August, prelim. and final examination as usual, same for all the colleges, that is in September. In practical continuous small assessments, we are trying to keep continuously. In November, we are keeping one OSPI because of the route of administration of the drugs. So in mannequins and all, it is a good time for placing OSPI in November. And at the end of everything, general pharma, that pharmacy and all, we can keep spotting and viva based on general pharmacology. Then we will try to give assignments on collection of ADR, because in general pharma, we will be teaching them pharmacovigilance, adverse drug reactions. So they can collect ADR from January onwards. Then April, the same terminal examination or term end examination or first internal, whatever you say, April. And May, June, again, we will give assignments on prescription audit. By that time, they will come to know many drugs, many diseases, treatment and all. So accordingly, they can collect prescriptions. And May, June, why we are keeping? In summer vacation, we can give them some homework that you can collect 10 prescriptions from your areas. It should not be from our own institution. Let them collect the prescriptions from outside the institution, so that they will get the actual picture that why we are doing prescription audit and rationality of prescriptions, etc., etc., the basis of prescription audit. In July, again, we can go for another OSPI, that is communication skill. Now you see that if we keep on doing this thing, it can be a burden for us. Workload will definitely increase, but the students will not have that much of exam stress. They will be seasoned every time, some small areas and all. I think it will be acceptable for the students, and they will be learning it not in the bookish knowledge but practical application as well. So this is the way we are planning for our institution. Our next issue, this thing I start with the quote of Martin Luther. Our very survival depends on our ability to stay awake, to adjust to new ideas. That is our new curriculum of CBME. To remain vigilant, that's how we are. That's why we are here together to discuss, to know, and then to face the challenge of the change. Next, now we will be, actually we have already started facing when we are planning our next 1 year curriculum. So now let us start with the discussion on the various issues and challenges. So challenges of competency-based assessment. So before the challenges, let us first go to the positive sides. What are the advantages of this competency-based assessment? Yes, we have to agree, we cannot deny that competency-based assessment, if we really go methodically, it is actually focusing on the outcomes and for learners' achievement. In competency-based assessment, there is a scope or opportunity of multifaceted assessments that embraces the formative approach. Multifaceted. We are going through MCQs, we are going through quizzes, we are going through problem solving sessions, we can go through OSPI, we can go through assignments. So in a various way, we can actually assess the students. It supports a flexible, time-independent trajectory through the curriculum. Yes. Throughout this 11 months, we have a flexibility. That much flexibility MCI has given to us. Only the restricted part is, it is starting in October, it has to finish by September. and rest is the flexibility at our hand. Another advantage is that it increases accountability. I don't know whether I should keep it as advantage or I should keep it in under challenge. Yes, accountability of the students' performance will be increased. Everything will be documented. Even if a student wants to challenge the final result, we have his whole linear progress in the formative assessment. So in that way, it is advantageous. Challenging issue is that so many things we are recording and document, planning, implementing, documenting. So that can be a challenge. Now the issues from faculty side, from our side, what are the challenges or the issues? The first thing is motivation, because it is a normal human psyche that whatever be the challenge, first there is a resistance. There is a change, there is a resistance first. So are we ready? Are we motivated for the new approach? So also the faculty strength or the number in the department. For 150 students, if there are adequate number of staffs or even one or two more, it is good for us. It is a big strength for us. But in certain colleges, maybe there is a paucity of faculty members and all. And if the number of students are more, especially, yes, for those colleges where 250 is the student strength, uh, it is challenging in all aspects. Are we trained for such type of assessment? So motivation and training is the very much integral part of change, of facing this change or the new thing. But yes, so far I know, even now also, I don't think all of us are properly trained or properly clear about CBA. Thus, the solution is more faculty or capacity development program is necessary at the departmental level, at the institutional level, so also at the national level. So I think we have already started at national level, then we can go to the departmental level, and in institutional level, it is there are nodal centers, regional centers, they are already conducting such program. But I don't think that only one program suffices the matter. We have to do some program or some faculty development program in each department, department wise. That will make us more clear and confident. Then coming to assessment process. No single assessment tool can capture all aspects of competency. That we have to accept and we have to believe that. So there should be multiple tests in multiple methods. I'm sorry, it should be multiple tests. It should not be multiple times and multiple methods. So that will definitely increase the workload of the faculty members. That can be solved in various ways. We will be discussing in the, that's why there is need of newer educational technologies. I will be discussing in a separate slide what we are doing here. That is online MCQ test, a good tool which has been proved for us, and it reduces the workload of teachers, especially when this correction of papers. It has reduced the workload because it is just like online examination. So initial load is on setting the program and setting the question. So once set and program, it definitely reduces the workload of the teachers. So if we have this software or this program with us, it is easy. I'll be discussing later again on this. Issues and challenges from the students' perspectives. The students, even for us also, why should I blame only the students? We always have a tendency to take the information from our seniors. So also the students do. So the seniors students can mislead them. Thus, they may get frustrated due to hearsay from the senior students. Initially, they will be disturbed with too many tests, so many exams and all. But once, this is our experience as well, once they are into the system, the students get adapted and can improve their performance. In Karamsad, there was a time in our department, over a period of 6, 7 or maybe more years, we used to take throughout the year, of course that was a 1.5 year, we used to take 8 to 9 MCQ tests, and that was the rule of the land, that was the practice here. So the students, they got adapted. But at that time we didn't have this software program and all, so we did have more workload, but the preparation of the students at the same time parallelly, it was helping them. Even today also we do take, but we have reduced that because we have started this integrated module. So with all the departments, we have to adjust with other departments requirement and all. And now even in last year also we test. So that's what I want to say, that once into we start the system from the very beginning, the students get adapted. And this can also be solved by us. We should give proper support and feedback. We as faculty members should give proper support and feedback. Online web-based MCQ will give a scope of practice for future postgraduate if possible. Of the medical colleges, except a few one, of course not all, I shouldn't blame all the medical colleges, but this is a common problem for us. Less time scale
Hello, Dr. Barna, are you there? Hello. Oh, Dr. Barna is offline again. पर मैंने पॉटी तो की नहीं। No, it's showing offline. Yes, now it's connected. Yes. It's not connected to audio. Your screen is visible. Screen is visible. You, you are not audible. You just click on the audio button there. Just below audio, this is something known as sound check. Click on no audio and wait for 30 seconds and then computer audio. Yes. Yeah. So no audio is coming. You click on no audio. Really? Yes, but now it has. Uh, there is some problem. So you just click on no audio and back to computer audio. Yes, now it is there. Yes. Hello?
Yes.
Yes, I can hear you.
Okay. Okay. So we have got less time scale.
You
And then
can go one or two slides behind. Just about one slide behind.
oh, sorry. From here again, I am just repeating.
Yes.
So what I was mentioning that as a faculty member, we should support the students properly. We should guide the students properly and give them a proper feedback so that their frustration, their disturbance can be reduced instead of for their hearsay from the senior students. And MCQ tests will give a scope of practice for future postgraduate entrance examination or other competitive examinations. Other issues like lack of infrastructure and resources for small group teaching and assessment. In many departments, there may not be postgraduate courses, so their MD students or postgraduate students, they can take some small group teaching along with us. So, but those departments where there is no postgraduate course for them, naturally it is a problem for small group teaching because of the bigger batch and all. Our time scale is 11 months, but if you go through the curriculum, this curriculum is not much reduced or cut into short. Rather, many things are included and incorporated. So the volume of curriculum and looking into the volume of curriculum and number of competencies, how much to prepare for the students and all, it is a challenging issue. Assessment to integrated approach and task base is not clear. Now, we in the CBME, we are integrating with the clinical departments, but who will assess, how it will be assessed, this is not very clear. And Another issue is calculation of internal marks. Like if there are, for MCQs, we said MCI has given 20% should be from MCQs. So if we take 3 MCQs or 2 MCQs, then one in between first internal and the prelim, then the percentage, how much weightage will be given to which type of exam, the calculation of all these things is really a challenging issue for us, and we have to devise and structure this from the very beginning, not that once it is started. What can we do as newer approach in Indian setup? We do have limitations. Like Western country, we do not have that type of infrastructure, that type of facilities and all. Whatever we are having, we have to do best out of that. So what my thought process went on, I am sharing that with you. Cognitive domain at all levels can be tested by MCQs. There are some controversies, arguments on that, but I will say that if they are constructed well, a lot of cognitive domains, a lot of levels can be assessed. We not only can assess recall of the knowledge, but higher cognitive level can be tested if it is well structured. We know that MCQ means only recall based, but no. We can prepare MCQs in a different way, in a various ways, and like we can, what I am going to share with you, what we, and this we have developed through our online or web-based MCQ test. Now, if you see that pre-PG NEET examination, there are big questions, but all are MCQs. They are giving case scenarios, they are giving problems, and then they are putting MCQs and one best possible answer. So if they can do that, we can also do that. And it is very well, it can be done. Once we can structure that, we can make it as a question bank. So it will be time saving for us. And we are actually in web-based MCQ test online. There is a software which we are having. It has really saved our time in correction process. We are not going to correct anything. We are uploading the keys, computer, that program is scanning and doing everything for us. They are providing us the result. Not only that, what we are not able to do, that program is doing, that is item analysis, difficulty level, even the discrimination level, etc. So I can suggest that this is a newer approach which we can incorporate in CBA, in the new coming CBA as MCQ test, and multiple MCQ test can thus help us. We can even put a scenario or case or problem as a stem of the MCQ. Even we can put up the graphs of general pharmacology of autonomic nervous system in the MCQ as a stem, and we can place some questions and all. Even video of 10 seconds can also be put up for comprehensive type or application or analysis type of MCQs. But here, yes, it is theoretical, but here I must say, in our scenario, in our subject of pharmacology, video of 10 seconds, there can be scarcity, may not be that relevant, but we have to think it is a new thing. In course of time, we can find out. But video for central nervous system, yes, Parkinsonism video and all, epilepsy video and all, we can show in 10 seconds, and then we can ask question in an integrated way, of course. Otherwise, pictures of adverse drug reactions, graphs, etc. can be put up, and if we can properly construct the question, we can also test the higher level over and above recall. And thus, through these multiple assessments can be done. Instead of one MCQ, you can arrange even 3 MCQs, 4 MCQs over the period of 10 months. And this is our observation that students actually like this type of assessment. Challenges are also there. It requires a good computer lab. IT-based problems can also occur here. Also today I'm facing a lot of IT-based problems. These are there. We should accept that. To prepare good quality of STEM in MCQ based on domain level and learning objectives. Yes, the STEM and the options, we should be very particular about that. Otherwise, the program itself will do item analysis and that can mislead us. Difficulty level, discrimination level and all, they can mislead us because they will be doing according to their. But if there is ambiguity, then that levels and all will come some erroneous. So we have to avoid ambiguous questions or options. And if we really use this type of software or program, we should avoid simple recall based questions. So that will serve our purpose of the domains, the SLOs and all those things we can address through this simple way. It is a cost, it is not free. So it depends on the institution, whether an institution, if they can provide us, we can really do the continuous assessment and competency based assessment. And through this software, we can prepare a quality question bank for next 3 years. Once we are done with that 3 years, let me tell you, the faculty workload will be reduced, and then we will update and upgrade such in course of time. So thus we are continuing with such type of newer approach. Now let me take up the first session, one scenario I shared with you on medication error. The question was, where are we wrong? There may be many reasons of medication error, but if we focus on a small piece of our teaching, learning and assessment, I think one of the reasons one important issue is assessment of students. If we continuously assess the students in various ways, I think through multiple tools, I think this can also contribute to reduction of medication error. And we, the pharmacologists, actually are responsible to some extent for the medication error because of maybe we have not trained them properly and we have not assessed them properly. Since we are having the scope of multiple assessment, competency based assessment, now we should not ignore that and we should focus that in future through our teaching, learning and assessment process, we can reduce the medication error in practice. So we can start multiple assessment through multiple tools. We can collaborate with clinical departments for assessments also. Thus, a rigorous, continuous practice of prescription audits also over and above teaching can lessen medication error in the long run. This is I am telling in context of the problem which I shared in the first session. So I think good assessment will reflect into reduction of medication error in future. Good teaching learning, no doubt, as well as good assessment. And one more thing is that self-assessment also, that is, we have to encourage the student through the continuous practice of prescription audits. And thus they will learn, we have to facilitate them, and thus we can lessen medication error in the long run. So I have got this much to share with you. If it would be very nice if we can get some suggestions from your side, and if there is any question, let us try to answer or discuss those.
Please raise your hands. Yes, Dr. Surbhi Gupta.
Good evening, everyone. I would like to ask Barna ma'am that in your assessment plan of your institution, you have shown that you will take 2 terminal exams, and then there will be university exams. But the CBME booklet says that we have to take 3 terminal exams. So I
No,
just want a
3
clarification.
exams, at least 3 assessment.
Okay.
Not terminal exam. We are confusing. Not terminal examination. We don't have the scope of taking so many terminal examination. I'm going back to my previous day's slides. Regular periodic examination shall be conducted throughout the course. There shall be no less than 3 internal assessment examination in each pre and paraclinical subject. Now, internal assessment is like this. Content of internal examinations, internal assessment can be theory tests, it can be seminars, quiz, etc. They have not mentioned about the terminal examination. This is up to you how you are planning. Even the MCQ tests also
Okay,
will
ma'am. Thanks
include
for
in internal. Yes.
Okay, ma'am.
Any other question?
Do we have Chandrakala? Yes, there are. Dr. Kamal. Dr. Shantanu Tripathi is also there. Dr. Shantanu, please unmute yourself.
Okay. So thank you, Dr.
Yes.
Barna. It was wonderful.
Thank you so much. Thank you so much.
In reference to
Sir, please unmute yourself.
okay. So this my comment is in reference to the earlier question put by some participant and some faculty, and that is about the terminal examination. Now you have very rightly pointed or responded to the question, but I was just thinking whether we should use these terms like terminal examination. If the curriculum or the guidance, MCI guidance book does not mention about terminal, so it is actually a legacy of the previous curriculum, that 96 one, where they had mentioned about this terminal examination. Now the moment you say terminal, it is about one term is ending and then you take a terminal exam. So earlier it was semester, first semester, then second semester, then third semester, it was 18-month this thing. Now it is 12-month and it is virtually less than 12 months. So whether we should continue with referring to the terms like terminal exam, or we can do away with that, we'll just restrict ourselves to internal assessment. When you talk of internal assessment, it goes very well with the formative assessment. Why it is internal? It is sub-university. Okay, it's at the institutional level. It is at the department level. So internal assessment, and it is a continuous assessment and formative assessment. Now the question is, what would be the frequency, and what would be the modality, what would be the strategy of these assessments? So that you have rightly again pointed out that about the flexibility. Okay, but every university or every department, they can have their own strategy and mechanism how they are going to have the formative assessment plan in these 11 months, so long the students are with them, and ultimately ensure that performance in these internal assessment series of internal assessments, the cumulative percentage should be at least 50%, so that they can qualify for participation for appearing in the final summative examination, that is a certifying exam. That is what I wanted to make this comment. Thank you.
Thank you, sir. Thank you so much.
Dr. Chandrasekhar. Dr. Veena Nayak.
Yes, sir. I had a question about remedial exams.
Okay. Hello.
Yes. You have.
Hello.
Oh, just a moment. Dr. Veena, you are self-muted. Please unmute yourself.
Yes, I have unmuted. Yes, sir. So I need.
Hello.
Yes, we can hear you. Oh.
I
Your
cannot
internet,
hear.
Dr. Veena's internet is coming and going. You unmute yourself,
Can
Dr.
she
Veena.
write in chat?
Yes,
Can
I needed to
can
know about remedial exams.
Oh.
remedial exams, I think, are for means improvement of the students. But how the marks? That means, do you want to say that whether their marks are included in should be included in internal exam assessment? Is it the question? Hello.
Yes.
The students need to be having a particular percentage to be qualifying for university exam. And
That is 50%. That is 50% is required to qualify for university examination of internal assessment. Hello.
Yes.
I think somewhere we have to also think about the group of students who would not qualify in the final exam, and there will be in the next session you have to handle those who did not pass the pharmacology exam in the last batch. It may be some 30 or 40 students, and the fresh batch where there are say 150 or 200 students. So we should also make a plan simultaneously with that. This is the first batch, so we are a little privileged. But from the next batch, there will be also some people who will not pass in the university pharmacology exam. So how to integrate them with the regular batch? So that is also one thing to be kept in mind. The second issue is about there will be always some challenge that in the internal assessment there will be some people who will not perform well, and despite the best efforts, they are unable to actually get that 50% bar. Okay, so how to deal with that? And in that case, in all in a realistic way, if you think, that there will be a lot of pressure that all these students are to be actually given 50%, and we have to do a little compromise that despite the fact that many of them are actually not eligible to get 50%. So these are also practical issues we have to think of, and what kind of additional kind of teaching learning or a special kind of teaching learning through these remedial measures, etc., for these backbenchers or non-performers in the first batch itself, in the regular batch itself. So this is also another challenge that one has to also have a plan about.
Yes, sir.
Okay. Over.
Can I say in that way, if
Yes.
we have so many MCQ tests, we have got that accountability of their performance throughout the year. So we can show the student, one student can do very bad in, for some reason or other, may do very bad in prelim exam, say, just before university examination. But he was doing quite good throughout the year in various MCQ tests and so on. Maybe he is in borderline. So these are the issues sometimes we need to take care that throughout the year he has done well, but prelim, surprisingly, he has done very bad, where he cannot be covered up for 50% even. So these are, I think, our challenging issues at that time, what we can do, and we do have the record. On the contrary, continuous evaluation in 1 year, a student is not performing well, and even in prelim also that student has not performed well, then he may be creating certain pressure and all. There comes the accountability. We can show that it is not only in the prelim you have done bad, throughout the year also. So answerability and accountability in that way can help us, but of course the final decision will be what depends on the department and the policy, departmental policy.
I think
But
we
definitely
should not give
yes,
overemphasis on the prelim. It's the whole year how
yes,
the
yes,
student has
yes,
performed.
yes. Even I also do agree with you that prelim. So what, sir, we are doing here, our internal assessment marks is prelim. We take, I think,
Some kind of stage
50%.
rehearsal for the final. Prelim is
Yes,
a
yes,
stage rehearsal for the final to help them.
yes.
Prelim cannot be considered as visa exam. So visa is throughout the year.
Visa is for throughout the year's performance.
Right.
Yes, yes.
Okay. Thank you very much.
Thank you, sir.
Dr. Kamal. And
Hello.
Dr. Gurudas. Yes.
Hello.
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 Yeah.
Hello, I am
Can you
Dr.
hear me?
Yes, I can hear you.
I am Dr. Tilani. I have comment to say.
Yes, sir.
Yes, ma'am.
Let us have a very clear understanding that at least 2 + 1 internal assessments and they should be formal, not informal during session or after 3 days or 4 days, 7 days. This is what I understand. At least 2 internal assessments plus 1 prelim, and it should be formal assessment in a well-structured format. Second, all appearing in all internal assessments is the eligibility criteria. A student will not be allowed to appear in university examination if he or she has not appeared in all internal assessments. Therefore, this should also be kept in mind. And the third observation is remedial measures. There are 2 ways it can be done. End of the session, and then there will be informal assessments, and they can be used as the yardsticks. One, A, and B is at the end of internal assessment 1 and 2, and at the end of prelim. Why I say it is for those students who are between 40% and 50% in theory, and those who are 40% and 50% in practicals and in both. They must be taken care, make up to render them eligible for appearing in the university examinations. So for them, a remedial measure should be planned well beforehand and should be incorporated just after administration of the test, maybe a day or two or something like that, at the end of one first internal assessment and also at the end of second internal assessment. And finally, for those who have a genuine reason for not appearing, or for those who are to make up 50% from 40% for them after prelim examination.
But sir, I have a question that
Yes.
when we are taking MCQs, that is also a formal test, and this is a different tool and a
My
continuous.
understanding about MCQ is that we are always depending on recall. Is making MC a good item is both art and science. It's not only science, but in art and science, and not all of us can make. And we have a restriction of 20% of MCQ, irrespective of where we are taken. If there is a
Yes,
university restriction of 20%, then should be 20% restriction in the formative assessment also. Otherwise, there will be very difference in the perception of the students and understanding. Now, the second point is that it is the overall assessment which is more important. Rather than one tool you are depending highly. 50% should be MCQ, rest would be 50%. It's overall multiple tools, multiple times, multiple examiners, and multiple methods. Everything is
yes,
incorporated. Therefore, an experienced teacher without too much objective test can assess, yes, he is up to the mark. He can be certified. Therefore, this point should also be carried. We should not go too much on the objective test, well structured, short answer, something like that. They will be deterrent because they will what to say favor test taking behavior, one, and second, discrete testing will be there rather than wholesome testing. So this should also be kept in mind.
okay, sir. Thank you, sir.
Hello.
Hello.
Good evening.
Good evening.
Can you hear me? Dr. Kamal here. This side.
Yes, yes, we can hear you. I can hear you.
Yeah. Madam, I just interested to know that how, according to CBME, how we are making the assessment plan in the practical exam, practical internal assessment. Like mannequins is mandatory for all the medical colleges, and route of medication administration is must for all, and it has to be checked, assessed in the final exam also. So at least there should be one internal assessment based on it. How many internal assessment rest of that from practical point of view?
This is the plan which we have made. You can tell it as in month of April, we have kept first internal as a formal exam, but we are also conducting auspice, we are also conducting spottings, we are also conducting assignments in piecemeals, so that it will not be burden for the students. They can appear with a
Assignment are the part of the practical assessment?
We have kept it like that.
And
Assignment of collection of adverse drug reactions, ADRs.
spotting also? Spotting also?
Yes, yes, we keep marks for that. And finally, we add all these things to the internal assessment. Depending on the weightage, we of course we give 60% weightage to terminal exam and prelim exam together, and then rest 40% on this formative assessment of OSPI, spotting, assignments, etc.
What is the kind of the assessment at your institutions for the first and after how many days after the beginning of pharmacology classes? Say for example 70 days, 80 days or less than that.
That
And
we
what are the
cannot
type of?
exactly, But are you asking for practical or are you asking for theory?
Yeah, I'm only asking for practicals.
Practical. If you see this slide, what I'm showing you, November we have kept one OSPI. Why? Because if we start in October, by the end of November, the students will be taught by that time the pharmacy, clinical pharmacy, routes of drug administration, dosage form, etc. So we are having 15 mannequins. So when we are showing them routes of administration, at that time we are showing them, we are demonstrating them the how to give IV and IM through the mannequins. And at the end of November, we can take up one small test on this, that just to see whether the students are able to learn that, and that will means learn how to give IV IM. That OSPI we have kept. Then in
So
December we are keeping
first assessment of the practical is the practical
that is up to
demonstration of
you
the.
how you can do. There we had other plans also, continuous evaluation test also, where we keep OSPI and spotting together along with Viva, but not in November,
Okay.
maybe it is December, January. When the general pharmacology portion is over, so also the practical on dosage forms, on the routes of administration is over. After that, we take a test.
First, you are taking the routes of drug administration or dosage form?
Dosage form.
Dosage form for the first, say for example, after 2 months of the continuous teaching, or
Yes, it depends.
50
This
days
is
of.
not the final one, some tentative plan like this.
Tentative, I'm asking. I'm not tentative, I'm asking.
Yes.
50 days, say for example, 60 days. Spotting of the types of dosage form is the first. What my understanding says. Hello? Hello?
Hello?
Hello? Yeah.
Hello? Yeah. So up to
So
your
dosage form is
convenience.
the, yeah, dosage form is
Yes.
the first you are suggesting is the first.
Now, if you teach other things, you can keep it accordingly. We start with
Okay.
dosage form and then the route means route of administration. So we are keeping in
That's good.
this way.
And how many practical during the entire length of the period? Say for example, 9 months, 11 months.
Now, what type
How
of
many?
practical
3 or 4?
if you want like first internal only, and these are all short tests, but we should not ignore the weightage and performance of these tests. Actually, these are very important, where we are giving more time to assess each student. During internal examinations and all, they have to go through so many tests together. But you see, over a period of 3 to 4 months, each aspect we are taking up and we are assessing.
Yeah,
So there
definitely.
we find more justified way of assessing each competency. So though these are shorter tests, but we are not ignoring the performance of these tests.
It was an excellent presentation. Congratulations on my part. Thank you very much.
Thank you. Thank you so much.
Hello. Hello.
Hello?
I'm Dr. Khilnani again.
Yes, sir.
For skills, that means actually the erstwhile practicals are not the actually depicted. A few practicals there. Total skill hours which I calculated and presented earlier are 100.
Yes.
Therefore, all the practicals in four topics are practical: communication, experimental pharmacology, clinical pharmacology, clinical pharmacy. All these we can be covered by 100-hour involvement.
Yes, sir. So that is the teaching time, no, sir? Hello?
100 hours in 11 months.
11 months, yes.
Yes, that can be covered. It will cover all the 4 topics. There are 5 topics in pharmacology. One is knowledge, cognitive, others are skill based. All 4 can be covered in it.
Yes. Any other comments or suggestions? Any more suggestions?
Hello.
Hello?
Can I ask a question?
Sure.
Okay. Ma'am,
May
when
I
we are
know
talking
your
of,
name? May I know
I'm
your
Dr.
name?
Rakesh. I'm Dr. Rakesh Mittal, professor at PGI Rohtak.
Yes, sir.
When we are talking of internal assessment, it has been
Yes.
told that there should be 3 internal assessment mandatory.
Minimum 3, not less than
Minimum
3.
3. Minimum
Yes.
3. And we have
Yes.
internal assessment theory and internal assessment practical.
Yes, sir.
So, does it mean we should have 3 internal assessment for theory and 3 for
Yes.
practical also?
Yes. Yes.
At least
Yes.
minimum 3
No
theory
less
and minimum
than.
3 practical.
Yes.
Okay.
Yes.
And second thing, students should appear in minimum number of IA internal assessment exam.
Yes.
So if we are conducting suppose 4 theory and 4 practical, so he should be
Yes.
at least present in 3 and not all.
I don't think so. I don't think so.
See,
Because it
minimum.
has told.
Hello, Dr. Kellan is speaking. See, minimum number is 3, and
3, yes,
it is
sir.
very clearly mentioned that the student must appear in all internal assessments, all tests actually. Therefore, if you are holding 4, you must appear in 4. If you are holding 3, you must appear in 3. If he is not able to appear in half of it or one part of it, then remedy is there. Remedial measure has been cared for there.
So because just for safety reasons, we want to take 4, and if somebody because of some undue circumstances is absent in 1, so at least he's completing the minimum 3 required.
Yes.
So
Yes.
that is what is my question. Rather than 4, when minimum number is 3, so we can mark him if he is present in 3, is eligible.
Yes,
Not
then
the.
university can decide. University can decide, even institution can decide. But minimum 3 prescribed by the MCI should be done.
Yes, sir. Yes, that is what. That is my question. Even if you have 4, conducting 4 for theory and 4 for practical, he should be present in 3 theory and 3 practical. That is what is my question.
Yes,
Minimum number
provided
required.
provided
He should
he
be
scores
presenting in
50%.
all. The only thing is, provided he is not able to appear in 1, then either remedy is done or some rules should be framed beforehand. Ideally,
Yes.
minimum 3 you
By
must appear.
chance, if the student scores 50% in internal assessment, he is
Yes,
eligible for exam also for
yes,
university.
yes,
Even if
yes.
he
No.
is
My
absent.
understanding is, even if he gets 50%, but he is not appeared in minimum 3, would he be eligible?
No, no, no. I am not telling that. I am telling, suppose there are 4 exams and he has attended 3 and he has scored 50%.
50%.
I think he
Yes,
should
yes,
be allowed for sitting
yes,
in university
yes, ma'am.
examination.
Yes, yes.
May I make a suggestion? Turnaround
Yes,
has come
yes,
because of the fact that many of the institutions were using the best of 3 or the best 2. So the students used to do well in the first and second, then they used to concentrate on path and micro, and they weren't doing the
important parts. That is the reason why MCA has brought out that the student should be present for all the internal assessments and get 50%. That is the reason this turnaround and this has come. But there is still nothing yet. If there is a student who is genuinely sick, had a big surgery for that matter, or some orthopedic injury or something, and couldn't attend, then we have to take into consideration. But on the whole, otherwise, all the students, otherwise they are lacking, the competency will not come out. That is the reason why all the examinations are important, and he should get in an overall 50%. Supposing somebody had a little fever and didn't do too well in one of the exams, he could just scrape through 50%. So that aspect is also considered. So the whole turnaround came is because of the fact that we used to use the best 2, best 3 or something. So that we don't want happening again. This is the reason why this kind of a change has come around. So that's the idea, but there is no clear directive by the MCI on this, but these are the points that are, and we have to implement this in the right manner. That is our challenge.
Yes.
Okay,
Yes.
one more thing, ma'am. One more thing. When we are talking of MCQs,
Yes.
We are talking of MCQs and we are talking them as formative assessment.
Yes.
As far as my understanding goes, formative assessment should not be a part of internal assessment test. Formative assessment test should not be a part of internal assessment.
No, not like that.
What have been I have been attending the workshops, so it is being clarified that whatever you're conducting for formative, because you give a feedback to the students, so you should not include it for internal assessment. So that is why one observation.
Nowhere it is written like that. I'm not sure. If anybody has got any answer, please come up. But formative assessment, even what we are doing, the MCQ marks, the first internal written test, prelim test, in between other forms of other MCQ tests or anything, we are all adding to internal marks. Internal
no, ma'am,
assessment.
that is, ma'am, we have been doing it earlier.
Hello, Dr. Kilnani again. By nature, internal assessment is formative assessment, essentially. One. Second, internal assessment has summative value also. There could be a debate on this, but summative value is also there. Therefore, when we say formative assessment, it is internal assessment will have inbuilt value of formative assessment, definitely.
Probably, sir, we can look at the literature by Dr. Tejendra and all. So probably they have mentioned it there in this book. I'm not remembering exactly, but it has been mentioned that formative should be.
Hello. Hello, can I say something? Can I say something?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Regarding the question you have asked, you are right in a way that when we say it is a formative assessment, we should not include convert it into the internal assessment. But what Dr. Barna is showing, though she is mentioning is as a formative, the formative assessment can be multiple and in multiple ways. Even in the class, if you show some MCQs, or at the end of the class, if you ask something, all these things, or you correct the journals of the students, or you are going through the log, all these things comes under the formative quizzes she mentioned. This is all formative, which she is not taking to the internal assessment. She is posing few additional internal assessment, this thing, apart from terminal, which can be counted, which are more than 2, as said, because MCI said only minimum 2. Maximum, there is no say on that. So she is multiple types of and related to the multiple domains as well as competencies. Multiple internal assessments, this she is counting. You can call them as to some extent as formative, because for those OSPE and all what she has mentioned, it may be possible for you to give them the feedback to even to the individual students.
But we will have it as
what
internal
you are
assessment. We will label it first.
what you are saying as a theory part of it, formative is usually not taken as marks are not counted for that, and that formative you can do now and then as an individual teacher, as a group, whatever. So there is no end to that formative assessment.
Okay, thank you, ma'am. Thank you so much, ma'am. One small question: paper A and paper B division has not been mentioned in the new, so we continue with the old one.
Only the marks.
I think this.
Yeah.
Yeah, continue, Barna.
Content part, yes, ma'am. Yes, ma'am. Content part, we continue with the old one.
I think we can continue because there is no formal division given in the curriculum.
Yes, ma'am.
So we are
yes.
Only the marks has varied. Earlier it was 80 marks and now 100, 200 marks.
Yeah. Yes, ma'am. And one more thing, when we are entering the skills in the logbooks, and we give one chance, then student doesn't improve, we give another chance for remedial. Now, how many chances should be given to the student?
I think in the logbook session, we will be having a session on logbooks, logbook and internal assessment separately. I think in both the platforms, we can discuss this issue.
Okay. Thank you, ma'am. Thank you so much.
Thank you so much. Any other question or suggestion?
Can I say something, Barna?
Yes, madam. Sure.
Hello.
Yes. Yes.
No.
Madam.
What I'm saying, some of the things what MCI has come out will be taken up by the university, and university will issue the order. Now, in your case, it is little bit easier for you because it is a separate university for your college. So
yes,
you can work with that and you can have it. But like for Maharashtra, MUHS may have some say. Means we can't do at individual colleges some of the things. We have to go the way the university will be telling us to do. So we have to abide by those university laws, and university will base their things on the MCI or this GMER.
Yes. Yes. There will be problems also for some at university level. For us in institutional level, I think whatever we will be suggesting as per GMER, university will just verify and then can pass it as per our requirement and all. So these are again some more challenges in implementation. Any other suggestion on this assessment or question? So can we end here? Hello?
Yeah. Yes, I think so. It's 7:26.
Okay. Thank you so much. These were my references, from which I took some of the informations for our whole sessions. Thank you so much.